Hi everyone, Dr. Kalaiko here, and I'm here to answer some of your questions about the COVID-19 vaccines and pregnancy, breastfeeding, and fertility. So one of the most common questions that we get in the pharmacy is, can I get the COVID-19 vaccine if I'm pregnant, breastfeeding, or planning to become pregnant in the near future? And what we know so far is that the clinical trials for the Pfizer and the Moderna vaccines did not specifically study the vaccine in these populations. So meaning they did not specifically recruit people who were pregnant, breastfeeding, or planning to become pregnant. So we have limited information in these populations. But what we do know is that during the trials, there were several individuals who became pregnant after receiving the vaccines and who went on to breastfeed after receiving the vaccines. So we are getting more information and we expect to know more soon in the coming weeks and months. Also, we know that since the vaccines have been authorized, there are many people who, in collaboration with their pharmacists and other healthcare providers, have decided to go on and get the vaccine while pregnant, breastfeeding, or planning to become pregnant. So we will learn more about these individuals very soon. Now, it is also important to know that the American College of Obstetricians and Gynecologists recommends that we offer the vaccines to people who are pregnant, breastfeeding, and planning to become pregnant in the near future. So, like everything else, this is a shared decision-making process between yourself or the individual patient and your pharmacist or your provider. So, like other medical decisions, it's a weighing of the risks versus the benefits. So, what we do know is that the risk of severe COVID-19 disease is higher in people who are pregnant compared with people who are not pregnant that are in the same age group. And so, that is going to be an important factor in making this decision. If you have medical conditions on top of that, let's say you have diabetes or heart disease or lung issues, that is also going to increase your risk of having severe COVID-19 disease. So that should also factor into your decision. So what do we know about the vaccines in these populations? In the animal studies, they have not found any bad effects on fetal development or on pregnancy outcomes. Based on what we know about the mechanism of action of the mRNA vaccines, so that's how they work in the body, we know that the mRNA molecule, again, this is the active ingredient in the vaccines, those are the instructions for your muscle cell to create a protein that looks just like the spike protein on the outside of the coronavirus. Then your immune system will then recognize that spike protein in the event that you are exposed to actual COVID viruses in the environment, and it will be able to attack and kill the viruses. So that's how it works. And then the mRNA molecule gets degraded or destroyed rapidly once your muscle cells have made that protein. So the mRNA molecule does not stay in the body. The mRNA molecule does not enter the nucleus of the cells or change the DNA in any way. In your cell, you've got the nucleus, that's where the DNA lives. That's sort of like the egg yolk part of the egg, if you will. And so the mRNA molecule stays outside. It stays outside in the cytoplasm, or the egg white part, you can think of it. And it does not enter, it does not mess with your DNA at all. So it is also very unlikely that the vaccine or any of the materials in the vaccine would cross the placenta and affect the fetus. It's unlikely that it would pass through to the breast milk as well. So how do you transfer immunity to the fetus or to the baby, whether it's through pregnancy or breastfeeding? It's really through your own antibodies that your body naturally produces in response to the vaccine. So it's not that the baby or the fetus is receiving that vaccine directly, it's that you are producing antibodies against the spike protein, and then through that natural immunity, your baby also gets some immunity as well. Let's see, what else? So, based on this information, we have no reason to believe at this time that the vaccine has any negative effects on fertility or on pregnancy or breastfeeding. There's no information yet on whether the vaccine affects milk supply. So, that is another question, and we don't know the answer to that quite yet. What else? So, very likely, based on the information that we know today, we believe that the safety and the effectiveness of the vaccines would be very similar in pregnant individuals as compared to non-pregnant individuals with similar characteristics, similar age and demographics and medical characteristics. So, would I get the vaccine if I were pregnant or breastfeeding or planning to become pregnant? The answer is yes, I would. And that's because, based on what I know, the risk of having severe COVID-19 disease, if I were to become pregnant, would far, far outweigh the potential risks of the vaccines for me. So I hope that helps you to make a more informed decision for yourself if you find yourself in this situation and you're wondering whether you should get it or not. Now, also, one thing to note, the University of Washington has created a registry that you can sign up for if you are pregnant, breastfeeding, or planning to become pregnant in the next couple of years and are planning to receive the vaccine. You can sign up to be part of this registry, and they will invite you to potential studies that you can be a part of if you would like to. And that is going to help us gather more information on how this vaccine is working in pregnant, breastfeeding, and individuals who are planning to become pregnant. So I'll put a link to that in the notes or in the comments section, and you can check that out as well. Thank you.